to the bone. That's according to a statement from his office. Well, let's speak to Imran Ahmad, a professor of urological oncology at the University of Glasgow. Thank you very much for your time with us, Professor Ahmad, here on BBC News. You might just be able to give us a bit more information about what this means. So when you read that statement about President Biden, what can you tell us about the severity of the prostate cancer?
Yeah, listening to the statement, it looks as though he presented with just urinary symptoms and subsequently is found to have quite aggressive prostate cancer, Gleason 9, which is, as you said, kind of metastasized or spread to the bone, which have obviously picked up on further scanning. So he obviously is going to go for further treatment, and it's now up to him and his the doctors looking after him to decide what kind of treatment regime he's going to go. But fortunately, he will have quite a bit of choice, the treatments he's able to choose.
And obviously we can't speak for Biden in particular, but for somebody who is facing this kind of level, this severity of prostate cancer, what are their options?
Yeah, so I think you have to take into account his age, his pre-existing health conditions, frailty, and usually the mainstay of treatment is hormonal treatment, essentially to reduce the testosterone levels in the body. And by doing this, you reduce almost the fuel to the prostate cancer. So you'll start to treat both the primary prostate cancer in the prostate as well as the metastasis. And newer trials have shown actually combination, if he's got what we call low burden disease, so not too many metastases to the bone, you might be eligible for radiotherapy as well. And also the newer drug agents such as abiraterone have shown to have a survival advantage in metastatic prostate cancer.
We were talking about how prostate cancer is the second most common cancer affecting men. Does that therefore mean that there are wider treatments available, that potentially it's more researched and there are more medications that can be taken because it is more common?
Yeah, I think so. Up until about 20 years ago, the only effective treatment for metastatic prostate cancer was essentially a chemical castration. But over the last 2 decades, we've discovered more and more agents, including different chemotherapies and novel targeted agents. So it's almost we're trying to turn metastatic prostate cancer into a chronic disease like high blood pressure or asthma. And although we're not quite there, there's a lot of promising research and findings occurring all the time in this space.
And again, obviously we can't talk about his situation in particular, but for men who have this, is it a painful condition?
So interestingly, from the information we've got, he just presented with urinary symptoms, which are actually very common in men over 70. About 8 out of 10 men will have some sort of disruption of urine symptoms, whether it's getting up at night to go with the flow. And it's only usually painful when it's spread to the bones. And that's how obviously Sir Chris Hoy presented the pain in his shoulder. But from the statement, it doesn't look as though President Biden had any evidence of any pain in the bones. It's only when they were investigating it that they picked up spread there.
So what do you... This is a difficult one to say, but we do know, don't we, that there are many men who are diagnosed with prostate cancer and live for very many years. But is this level that we're looking at with President Biden more serious and therefore requires more serious treatment?
It definitely requires treatment, and it will require quite aggressive treatment. In terms of your question is potentially best case scenario, how long does he have it? But it could be in the region of multiple years, certainly with all the newer drug agents, the chemotherapies. I get patients all the time that present with similar presentation to President Biden, and they ask me, well, how long have I got? And the honest answer is we don't really know. It just depends how well they respond to the treatment. And the good thing is there's multiple lines of treatment we can try. So if the first line of treatment doesn't work for President Biden, there's another at least 3-4 lines of treatment he could go through, all of which may give him up to 3, 4, 5 years. So I think although the news is it's aggressive prostate cancer, I think with the current treatment regimes we've got, it certainly shouldn't be we shouldn't be thinking, okay, that anything is imminent.
Just finally, it's important to say that, you know, if anyone is out there and concerned about any of the symptoms that they might be hearing and thinking that they may be experiencing themselves or a family member, presumably first step, go to your GP.
Oh yeah, definitely. If you've got worried about your urinary symptoms, you've got family history, go to your GP. And a simple test like a PSA test, which is what I assume President Biden had, will pick up a large proportion of patients who may be at risk.
OK, Imran Ahmad, we really appreciate your time here on BBC News. That's Imran Ahmad there, who is a professor of urological oncology at the University of Glasgow.